But for now, let's turn to a health story that is causing concern. Toronto SickKids Hospital reporting more cases of severe acute hepatitis among children. There are unexplained outbreaks happening in several countries. And to talk about what is happening here at home and abroad, let's bring in Natalie Collado right now. So Natalie, walk us through what we know so far about this liver ailment.
So Michael, these cases were being identified between October 1st, 2021 and April 30th, 2022. And officials are saying there are 7 cases of severe acute hepatitis at Toronto's Children's Hospital SickKids. Now, in a statement to CBC, the hospital officials, they have said that they are closely monitoring the situation. We know the Public Health Agency of Canada has not yet provided specifics on how many cases are being investigated Canada-wide, so right across the country. What we do know, hepatitis refers to an inflammation of the liver. It is very rare among children. It's typically caused by the family of hepatitis viruses, but it can also be sparked by alcohol use, exposure to toxins, or other pathogens. Researchers are now trying to probe why this is happening, including theories which may link the infections from something called an adenovirus, or the SARS-CoV-2 virus, the virus behind COVID-19. So what is causing this is something currently under investigation. It is likely, though, Michael, to take some time before those answers are found, including determining whether or not the cases we are seeing here in Toronto, possibly across this country, are related to the unexplained instances of hepatitis among young people that we are seeing around the world.
Well, talk to us about that, because as we said right off top, we are seeing similar cases in several different countries, and there is this question of whether or not there's a connection. Yeah, and officials are looking into if there are links between the instances of the serious liver disease among children popping up in other places, and here, places like the UK, US, Israel, and elsewhere. Hundreds of investigations are currently underway globally to determine the root cause of this unexplained liver issues among youth. In the US on Friday, the US Center for Disease Control and Prevention said it's looking into 109 cases. 14% of those children required a liver transplant, and 5 died from the illness. Now, the cause identified by health officials around the world in recent months don't really appear to have any of the usual causes. We know that in the UK, where there have been at least 163 cases since the start of this year, including 11 cases which required transplants, officials say that the leading hypothesis really is focused on that adenovirus. And they say that in a briefing note on Friday, the Health Security Agency in the UK, that they are continuing to investigate the potential role of the SARS-CoV-2 and are working to rule out any of those toxicological components. So it's still very much a mystery. Have a listen to how infectious diseases Dr. Jane Chagla put it. Have a look.
I don't think the answer is a simple smoking gun here. The adenovirus thing is interesting, and certainly we've seen adenovirus as a cause of hepatitis in immunocompromised populations. But even then, why now, and why, in the context of certain countries, not others, the context of certain time frames and not others, is it causing problems, and is there a cofactor, a toxin, a genetic, or another infection like COVID-19 that might be also involved in all of this?
And naturally, Michael, we are keeping a very close eye on all of this.
Natalie, thank you for that. Our Natalie Collado.